Right, Eric. Okay, there you go. All right, all right. Welcome, everyone. I hope we're having a wonderful week so far. So, welcome to our webinar called Get Ready. This is a bit of a mouthful. From Data to Action, using the $154 billion Man Report to support greater investments in fathers. My name is Justin. I am NFI's Marketing and Training Coordinator, and today I have the pleasure of supporting this training alongside with the whole NFI team, alongside our speaker for today, National Fathered Initiative's President Christopher Brown. And as you may have seen in our waiting room and emails, we're also joined by guest speakers who are leaders in fatherhood and family initiatives. So stay tuned because they'll be introduced later, and you'll be able to hear from them in the session. So, in the background, who will also be responding to questions and chats is Chief Marketing Officer Melissa Byers. So, I know that we're excited to start, but let me just take this time to announce a few housekeeping rules and logistics for a smooth webinar for today. So, we will be together from now until 3:30 p.m. Eastern Time. So, for the best experience, we recommend closing unnecessary applications and ensuring that you have a stable internet connection. So this webinar is also being recorded and will be made available to everyone within a few working days. You can also use the chat function to share your thoughts and interact with other participants. Feel free to share your name, job title, and organization and where you are coming from. So if you have any questions, please use the Q&A box found below your video. We will address as many questions as possible in that box during the webinar. If there are any unanswered questions, we will reply to you in an email after the webinar. Once your Q&A question is answered, it will also be available for other participants to view. That said, please refrain from using the Q&A box like the chat box. Also, please be advised that we may not be able to see your questions on chat. So after the webinar, there will be a brief survey, and we ask that you please take a few moments to let us know your thoughts and suggestions about the webinar. So without further ado, Chris, you may take it away.
All right, thank you, Justin, and welcome everybody. On behalf of National Fatherhood Initiative and the Center for Policy Research, welcome to our webinar today. I must say I'm very excited about this report. We've already received a lot of positive feedback on it, and we'll be discussing later on in the webinar how you can use the report to leverage investments in fathers. A couple more housekeeping matters. We have two handouts that we'll link to in the chat. The first one is a copy of the slide deck and also an infographic to share that highlights the report's findings and uses. And we'll put those links in again at the end of the webinar for anyone who might arrive late. If you have a question for the presenters, please use the question and answer portion of the Zoom window to ask your questions. Try to refrain from using the chat function. We will try to answer most questions in real time, but if you happen to ask a question that we think everyone would like to hear the answer to, we may flag it for the Q&A portion that will conclude the webinar today. So without further ado, let me introduce my co-presenter, Dr. Jessica Pearson. Jessica founded the Center for Policy Research in 1981. Her work includes pioneering national studies on custody mediation, parent education, supervised visitation, and innovations in child support programs. In the fatherhood field, she has evaluated employment programs for low-income fathers and interventions to strengthen co-parenting and father engagement. She also directs the National Fatherhood Research and Practice Network and holds a PhD in sociology from Princeton University. We also have a fantastic guest panel today. Let me start by introducing Richard Reeves. Richard is founder and president of the American Institute for Boys and Men. Previously, he was a senior fellow at the Brookings Institution, where he researched economic inequality, social mobility, and issues facing boys and men. He is the author of several books, including Boys and Men and Dream Hoarders. He founded AIBM in 2023 to advance evidence-based solutions to challenges facing boys and men. Kimberly Dent is executive director of the Ohio Commission on Fatherhood at the Ohio Department of Children and Youth. The Commission funds fatherhood programs across the state, provides professional training, and advances policies that strengthen father involvement. With nearly 28 years of government experience, Kimberly has served in multiple roles within Ohio's child support system and previously represented the Ohio Department of Job and Family Services on the Commission. She holds a bachelor's degree in political science from the University of Pittsburgh and a master's degree in public policy and administration from Ohio University, and is currently completing her PhD in public policy and administration. Sherry Richardson is the Title V Family Engagement Manager for the Georgia Department of Public Health within the Women, Children, and Nursing Services Division. With more than 25 years of experience supporting families, including children with special healthcare needs and disabilities, she leads statewide strategies to elevate family voice, strengthen cross-sector partnerships, and expand inclusive engagement practices. Her portfolio also includes fatherhood initiatives that integrate and support fathers in maternal and child health programs. So to start, before I share a little bit about National Fatherhood Initiative and turn the presentation over to Dr. Pearson, I want to mention that you can download the report if you haven't already, either at the first link from NFI's website or the second link from CPR's website. So a little bit about NFI for those of you who might not be familiar with our organization. Our mission is to increase father involvement by equipping communities and human service organizations with the training, programs, and resources they need to be father inclusive. Our vision is that all communities and human service organizations are proactively father inclusive, so that every child has an involved, responsible, committed father in their life. We pursue our mission and vision by building partnerships with community organizations at the national, regional, and state levels. We work a lot with state and county government agencies and with direct service providers in communities. Our focus is on building their capacity to more effectively engage fathers in their programs and services, using evidence-based programs and evidence-informed resources, providing staff training to build staff knowledge and capacity around effectively engaging fathers in programs and services, collaborating with organizations in a variety of ways, and providing free ongoing technical assistance as needed. Okay, Jessica, you're up.
Thank you. Thank you. This is exciting, and I want to thank in advance all of our panelists and the audience for turning out for this presentation, this webinar. Chris, you've done a great job introducing CPR. I'm only say that, clarify that we do our work through research and evaluation to essentially determine how and if policies and programs work, how they can be improved. We partner with states and the federal government and local programs to do demonstration projects that tinker with new administrations or new ideas. And a lot of our work has been in the child support arena, trying to make the program a little less punitive and more responsive to the needs of low-income families and fathers. And yes, in the fatherhood arena, we've evaluated responsible fatherhood programs, looked at the issues of parenting time and how that affects child support payments, state practices that support fathers, and the creation and direction of the Fatherhood Research Practice Network, which does research and policy work and information dissemination. So next I think just everybody will, in this audience, appreciates how slow and hard policy work is. Sometimes it's like watching paint dry, but over time, we've seen our work contributing to some modest changes in the fatherhood and parenting time field, the emergence of the Access and Visitation Program, Grant Program, some federal rules that advance some more progressive policies about modification of child support, informing a recent federal rule on funding, using federal funding for employment programs in the child support program, and so forth. Okay, let's go to the agenda. I'm going to give you a little overview of the report. Then Chris is going to talk about sort of tips on how to use the report. Our panelists will talk about how to address some of the report findings, and we'll wind up with questions from the audience, and what we can't address on the webinar, we'll respond online in the chat. So on to the overview. Essentially, this report updates a 2008 report that NFI released called the $100 billion man. And it looked at expenditures on 14 major governmental assistance programs in 2006 that were made in father absent, which we are defining as single mother-headed households. So we updated it. We also improved the reliability of the 2006 data, which had been drawing from household composition from a variety of sources. We use one data source rather than multiple. We compare 2006 expenditures with 2018 expenditures and updated all to 2018 dollars to account for inflation. We introduced some differentiation in the treatment of single mother-headed households, and break down patterns for never married, separated and divorced, and widowed. They all go under the general classification of single mother-headed households. And finally, we include recommendations on how to strengthen the economic position of fathers and promote more engagement with their children. The next few slides are going to give a little bit of background and context. First, the living arrangements of children. And as of 2023, the census reported that 2/3 of children live in married two-parent households. 21% live in a mother-only household. And then we have some other, some small percentages in other arrangements. The bar graph here shows that there are different types of single mother-headed households, and that they have changed over time. This traces living arrangements from 1960 to 2023. And as of 2023, we have 4.3% households are headed by widows, 17% are headed by separated mothers, 28% headed by divorced mothers, and 50.8% are headed by never married mothers. The divorce revolution began in the 1970s, peaked in 1980s, and has been declining since then. Widowed households have fortunately also declined, and there's been an increase in never married households. Here we compare different married and single mother-headed households, and it shows that there are stark differences on a number of domains. Yeah, I think most significantly is a difference in education, of parental educational levels in these two types of households, and single mother-headed households. College attendance and graduation is substantially lower than it is in married households. Connected to that are patterns in fathers' real earnings from 1980 to through 2019. And I think this reflects the loss of well-paying manufacturing jobs to non-college educated men during that time. So looking at earnings for non-college educated men, they declined by 9% between 2008 and 2019. For college educated men, they increased by 35%. Median household income in 2019 was also vastly different for single mother-headed households and married households. In married households, it was more than 2 times higher. There are substantial racial disparities between the two types of households. 63% of married households are non-Hispanic white, and 62%, and an identical 62% of single mother-headed households are Black and brown, and only 38% are white non-Hispanics. Poverty rates are 4 times higher, almost 4 times higher, in single mother-headed households, and the use of government assistance programs is more than 3 times higher in single mother-headed households. 50% use at least one government assistance program per month, as compared with 14.7% of married households. Finally, child outcomes. There's a very robust literature on child outcomes correlated with father absence, many negative child outcomes, correlations, not causation, but there's overwhelming evidence that children in single mother-headed households have poor academic performance, lower adult employment and earnings, higher rates of incarceration, teen pregnancy, behavioral problems, substance abuse. Fortunately, there's also a growing body of literature that shows causal effects of the impact of government assistance programs. And they link interventions that alleviate poverty by providing income or transfers of food, housing, medical care, and other supports to the improvement of adult health and adult economic well-being. So it's associated with improved academic performance, increase in adult employment and earnings, reductions in behavioral problems, and improvement in adult health. Okay, how did we do this report? Well, we used 2 main data sources: the federal budget in 2006, federal budget in 2018. We use the Survey of Income and Program Participation, known as SIP, to determine proportions of the different benefits accorded to different segments of the population, different types of households. So the SIP is a survey conducted by the census annually They focus and follow sample households over a 4-year period of time. They ask them about their income, their wealth, their household composition, and their participation in a wide range of government programs. By using the SIP, if in both 2006 and 2018, we're able to determine the household use, different type of household use in of these 14 government assistance programs. And now I'll mention them. It's sort of an alphabet soup of acronyms, but for income, we look at EITC, TANF, child support, SSI. For nutrition, we looked at SNAP, school lunch, WIC. For health, we looked at Medicaid and CHIP. For early childhood, we looked at Head Start and childcare. For energy and housing, LIHEAP, Section 8, and public housing. Then, combining budget with SIP estimates of household use, we were able to determine the total program costs that go to different types of single mother-headed households at both points of time. We stayed with 2018 to avoid the COVID years, and we adjusted all costs to $2018 to account for inflation. I should mention that 9 of these programs of 14 programs are uncertain at this point due to changes introduced or proposed in the in the OBBB bill and the discretionary budget. So it may not be possible to do another round of updates going forward, but we'll see. What are our findings? Well, between 2006 and 2018, expenditures for single mother-headed households for these 14 programs increased from $100 billion to $154.2 billion. And that's a 54.5% increase. So that's the main thing. Another finding is that these are, at both points of time, they were severe underestimates. Even for the 14 programs, we did not include the state match that's required for these programs, which is typically 34%. We don't include any state expenditures for state-funded programs. We don't include many programs for which there's no household data that's maintained. We don't have data on household types that use child welfare or foster care or a Healthy Start or juvenile justice services or Title I. Those are all relevant programs. We just don't have household data. And we don't have long-term indirect costs of father absence over time, which would translate into lower earnings for children, lower tax payments, higher incarceration rates, special education costs, etc. Others have estimated that the federal government invests over $500 billion for children living in poverty per year. And that's probably an underestimate as well. Finally, another main finding is that all types of single mother-headed households use government assistance program. We found that whether divorced, separated, widowed, never married households all use WIC, Head Start, school lunch, and housing support roughly in proportion to their incidence in the population. So it's not exclusively a never married household benefit. We found that never married households We're overrepresented in programs that alleviate child poverty. So they are higher users of TANF, SSI, SNAP, Medicaid, CHIP, and childcare. And widowed mothers' households are higher users of SSI, but all of them use a core group of government programs that deal with food and education, and housing support. All right, now on to recommendations. What do we do about this? How do we assure the well-being of children in single mother households? How do we minimize the burdens of poverty on taxpayers? How do we create jobs and improve income for less educated parents? That's what we're going to be talking about today with our panelists and with you. Here are some of our thoughts to get us started. I think we have to try to reduce costs and stress of child rearing for all parents. And this involves accessible and affordable childcare, expanded child tax credit, prenatal and family leave, raising the child independent dependent care credit, eliminating the marriage tax, and rental assistance and zoning reforms to increase housing supply. In other words, we have to make marriage and having children more affordable and attractive to people. And these are some of the ways many are proposing paths that we pursue. Second, we have to enhance the economic position of fathers. We have to improve jobs and earnings among non-college educated men. What does that entail? Increasing the minimum wage, expanding the earned income tax credit for non-resident fathers who are really classified in the tax code as childless workers. Improve public and private employment for those with a criminal records so that they can get back into the workforce. Increase attendance and completion of post-secondary education, be that tutoring, tuition support, supportive services for low-income men, fund more technical education, apprenticeships and workforce training, and implement the 2024 child support final rule to allow federal funding for employment services for parents who fall behind in their child support payments. We have to address racism and other structural inequities. According to the National Bureau of Economic Research, Black workers face higher rates of unemployment, underemployment, lower wages, lower benefits, and lower earnings growth than their white counterparts at every level of educational achievement. It's not just a low-income father problem. It's all levels of education problem. And so at a minimum, we need to enforce our non-discrimination laws and work on redressing and eliminating these racial disparities. And finally, we need to better engage fathers in family services. We need policies and programs to routinely engage fathers. Too many programs at the federal and state level are framed as mother-child interventions, don't lend themselves to father engagement, and We don't track father involvement or father participation, with very few exception. Head Start does track some father engagement. Other programs do not. Healthy Starts began to require some father participation. There was a proposal to require father participation, or at least just tracking, in home visiting, and that was taken out of the Federal Register final rule. So without tracking, we don't know what's happening, and that has to happen on a routine level. And lastly, because we are researchers, of course, we recommend research in addition to the work that needs to be done at the program level. And there are many important things to study. But we basically need good policy. We need good policy and programs, but we need to show if and whether they work, who they work for, how they're best implemented, what benefits they yield for individuals and society. So in the interest of time, I think I'm going to just say a few words about, again, the types of programs and policy, research on programs and policies that build fathers' economic capacity. Meta research and analysis shows that traditional fatherhood programs improve parenting quality and co-parenting and father involvement, but they have less impact, and they're not particularly effective in improving their economic capacity, their employment and earnings. So what will do that? I think that's a nut that we have to try to crack and focus on. We also, and I think that, without looking down the road too far, some of this is going to come into play with the employment of college-educated men. As AI becomes more prominent in the employment sector, I think we'll be having this conversation about college-educated parents as well in the not too distant future. The last type of research that we need, for which we really are, and which we have not been doing, and there's a serious shortage, is return on investment research. Legislators want to reduce government and taxpayer costs and increase earnings and taxes paid by those who work and earn. And this kind of research has barely been done for the fatherhood field. So we need to be more diligent about measuring immediate and long-term costs and outcomes and benefits of the remedial interventions we develop and the programs we start, and translate those findings so that they're accessible and understandable to policymakers and the general public. So with that, Chris, I'm going to pass the baton back to you for tips on how to use this report, and look forward to the forthcoming discussion with our panelists.
Absolutely. Well, thank you very much, Dr. Pearson, for presenting the results of the report. And, when we released the $100 billion man report back in 2008, which it's hard to believe that's 18 years ago, one of our big misses was that we didn't include really good recommendations for how to use and leverage the report. So when we decided to update the report with this report, that was a commitment that we made to help organizations and individuals who are really committed to supporting father involvement with ways that they could leverage the report at different levels and in different ways. So that we can get on to the panel discussion, I'll just draw your attention to this a slide. I won't read through it. I do want to mention and emphasize that we really want this report to be a tool for change. And so when you download the report, you will find at the end of it a two-pager that lists a variety of ways that you can use the report. And I'm confident that the panelists today will have some other ideas as well. So let me just reintroduce the panel. Richard Reeves, Kimberly Dent, and Sherry Richardson. So what I will do, panelists, is I'm going to ask you a couple of opening questions. Just feel free to respond in whatever way that you would like. And then after that, I will ask you some questions that are based on your respective organizations and the perspective that I think you bring to this discussion. So with that, the first question I'll ask Kim, I'd like you to respond to it. First, when you read the report, what was your initial reaction to it?
Okay. Oh my gosh, Chris. Well, first off, I remember when I became executive director of the Commission on Fatherhood back in 2012, the $100 billion man report was out. And that was so compelling and it was so helpful in me making that economic argument, right? And so excited when the updated version was released. We do have some General Assembly members that were also looking for the updated version. So when this report came out, it was perfect timing because I had a commission meeting that same week and I was able to provide it to our General Assembly members. And so I know they're perusing it and going through it as well. But I do want to state, first off, excellent idea to stop at 2018 because I do agree that COVID would have skewed the numbers. I also thought about we are really missing the mark on generational poverty and interrupting that and not focusing funding on like TANF Purpose 3 prevention because I feel as though when we get further upstream, not just early intervention, but prevention, and we start to intervene with youth or children who were born into poverty, right? Because we talk about generational poverty. And so children that are born into poverty are more likely to become adults in poverty. And then they have children in poverty. And it just goes on and on. At what point do we intervene and say, can we talk about preventing out of wedlock pregnancies, which is TANF Purpose 3? The other thing I thought about was again, the education, income, and the marriageability. I really enjoyed reading those because some things you never really think about, but thank you for calling that out. As you know, I come from the child support program. And so in 1998, I started as an enforcement officer at Franklin County Child Support. And so it rang true. The cases that were difficult for me to get child support payments on were not the divorce cases. They were the never married cases. So I'm talking about the late 90s, and it still rings true today. The other piece that stood out, again, I thought it was conservative, and I think Dr. Pearson had mentioned this. It does not include state level match. So this is a very conservative number. If we really took a look at what the states were putting into the households, it would be larger. And then I always have to go back to Father Facts 8 and 9, right? We're talking about the economic, right? We're talking about the argument for investing because of taxpayer dollars going to these households. But then we don't talk about in this report because we do have Father Facts 8 and 9, where we talk about the well-being of children. And you can't put a price tag on what happens with our kiddos when dad is not in the household or he's absent from the child's life. So I am going to say, and then lastly, because I want to have my colleagues be able to kind of chime in as well. One of the other pieces that popped up for me was the school to prison pipeline. Like, where are we there? where do we stand in that pipeline to pull these kiddos out, right? So that they're not making these decisions regarding having children before they're ready. I am funding a pilot project here. We have a lot of programs we're funding in Ohio. With the additional 20 million in the budget, we're going to be funding a lot more. We're trying to get fatherhood programming in all 88 counties, but I am funding 110 of Purpose 3. And this report convinced me that I need to continue to fund No Kidding Ohio, again, which is young parents who did take the path of becoming a parent before their time or before they were ready, going into the schools and sort of doing this straight talk from teen parents, sixth, seventh, and eighth grade, and some ninth grade, because anything past ninth grade, it's kind of hard to reel those youth in or those young adults in. But sixth, seventh, eighth, and ninth grade, I think it's important that we get in front of them and have these other peer educators talk a little bit about the struggles as being a young parent and not being ready and not being married, so forth and so on. So there were a lot of other things that came to mind, but I'm going to just stop there and just allow my colleagues to chime in too. Thank you, Chris.
All right. Well, thanks for that wonderful response, Kim. Richard, same question to you. What was your initial reaction to the report?
Yeah, congrats on the report, Jessica and Chris. Honestly, it was mixed feelings. On the one hand, I really appreciated a number of aspects on the report. One is, I think, just quantifying just the scale of the importance of the issue. I thought that was hugely important, very positive, and I like the approach to that. I really like the focus on which Jessica ended with the economic importance of fathers. And the policy proposals that actually kind of point to that, which is economically flourishing men, more likely to be fathers and more likely to be able to be fathers. So I really like that. I think the kind of um, evidence that kind of the economic flourishing of dads really matters was very, very good. And I liked the work on looking at the kind of causal evidence for how a lot of these programs, the ones that are actually costed out in the report, as well as father involvement, have these positive causal effects on kids' outcomes. So I really like that. I think the tension in the report and the reason I had some mixed feelings was because I do think there's a kind of narrative here which can potentially plays into a deficit framing, right? Which is this sense of like dads are absent, it's costing us all this money. And you can imagine that for some people that would be used as a justification for cuts, right? And I think the report leans the other way. I think the 154 is too low, if I'm reading you
Exactly.
correctly, right? We're not spending enough, not that we're spending too
Exactly.
much, right? But I think it can be seen in that kind of way, and also might add a little bit to the sense of like us, the primary way in which we value fathers as being economic. And I don't want to in any way take away from the economic contribution of fathers, but as you point out in the report, there's growing evidence about like dads matter as dads, period, right? Not just as quotes walking wallets and so on. And I know I'm preaching a bit to the choir here, but I think these are really difficult tensions. And in some ways, I almost felt like the report was caught a little bit between two worlds. The sort of world
Mhm.
that focused very much on single parents, on child support, on father absence, fatherlessness, etc. And a kind of, I think, the emerging world, which is much more around father involvement and engagement, independent of family structure, not being naive about the fact that family structure really matters, but just kind of dads like really mattering, period. And we are in a world where we're going to have very high numbers of non-resident, quote unquote, fathers, right? It's not a binary of single parents versus married parents. There's a huge amount of heterogeneity in between the two now. And so helping dads to be dads seems to me to be the goal here. And that's, of course, going to cost a lot more, right? There's a long list of things here which are going to cost more money. And so I think that it's very important we don't frame this as a kind of cost saving exercise, at least in the short run. That said, I do think it's clear, and I've just put a thing in the chat here on our own work, and I'll maybe put the chart in too, showing it's pretty clear that, particularly in lower income areas, when men are doing better, marriage rates are higher, right? That seems pretty clear, right? And so direct approaches to marriage promotion do not seem to have been hugely successful, but indirect approaches, which are just like if people are doing better, they're more likely to get together and have kids, just seems true. And so I think there's a strong alignment here between a lot of the work we're all doing to kind of improve the economic flourishing, especially as you point out in that table, Jessica, of men without college degrees, where we've seen stagnant wages, and that's where the decline in marriage has taken place. There is a massive class gap in marriage now that did not exist before, and we have to name that as well as the racial ones you've already named. So I'll stop there.
Well, thank you, Richard. Yeah, if you'd have been a fly on the wall and heard some of the discussions we had around terminology and trying to position this as much from a strengths-based perspective as a
Right.
as a deficit. I think you would have appreciated that conversation. It was a real struggle for us. We wanted to make sure that we, were reporting based on what the data showed us, but to try to frame it in a way that can work for people in terms of understanding the economic impact, and then also being able to leverage the report for important work. Sherry, same question to you.
Just a second, Rich, Chris, I want
Yes.
to note that there's a sentence that says, it's not addressed in this study. We want to note that the federal tax benefits for wealthy families are estimated to be far higher for than any of these are, and we didn't want to get into sort of a war between wealth and non-wealth, but they are estimated to be higher. And
Yeah, it's not like we can't afford this.
no, it's not why we can't afford it. Never, not at all, not at all. And the IRS information that just came out today about, the higher refunds that wealthy families are getting is right on point.
Sherry, what was your initial reaction to the report? Is Sherry with us?
Sherry's on mute, I believe.
I apologize.
No
My
worries.
little technical glitch. My initial reaction to the report was that it reframes something we often talk about in public health, and that is family stability and child well-being. And it frames it into an economic conversation that agencies and policymakers can really pay attention to. Something we cannot ignore. You can't ignore it. And the estimate that the U.S. spends about 154 billion annually on these programs really underscores how deeply family structure intersects with public systems like Medicaid, SNAP, WIC, housing assistance, those type programs. And many of our program participants are recipients of these programs. And to actually work sometimes directly with the families, and we're providing, programmatic support to the families to hear the struggles that they have as they move through these systems. So sometimes they're dropped from Medicaid, or they may be dropped from SNAP or WIC for different reasons. But to actually be there holding their hands working through it, we know that these are systems that need to be supported. And the father piece of these systems is really what's missing. So it it just can no longer be ignored that we have to continue and more strongly work on supporting fathers in these systems. And also from a public health perspective, what stood out to me closely was that the report aligns to what we see in public health data, which is communities experience family instability, have higher rates of poverty, worse health outcomes, greater reliance on safety net programs. So the report basically highlights that we largely operate in a reactive mode rather than a preventive one. So let's get out in front of what we need to do to make these systems work better for our families. And lastly, I must say that I gasp, and as we say in the South, clutched my pearls or grasped my pearls when I saw the 50% increase in expenditures within that 10 to 12 year period from your first iteration of the report. And this just confirms that we have to stay committed and move forward with our fatherhood programming and supports. There is just no turning back. We have to move forward and faster to get the correct systems and ways and balances in place to make these programs and systems work better for our families so that our families are more stable.
Great. Thank you, Sherry. So I'm hearing a prevention theme here in those initial comments, and I can definitely appreciate that. So, Kim, I've got a question for you specifically related to the structure of the commission. So, you're the director of a state fatherhood commission established in statute as a way of institutionalizing a fatherhood initiative.
Right.
How is that approach effective in developing and implementing father-supported policy and programs at the state level?
Wow. So for those of you that don't know, I'm going to give a real quick sort of description of what the Commission on Fatherhood is here in Ohio. So we are in state law that we shall exist. We've been in state law since 1999. When I took over the commission, I had one full-time staff and one intermittent staff, and then myself, and we had $1 million to do the work in Ohio. And again, with reports like Father Facts 8, the $100 billion man, Father Facts 9, Jessica, your state by state, your team's report there that we still, folks are still asking about.
Oh.
I now have 5 staff, and we have $25 million over a 2-year period to get the work done. So the commission also has 20 commissioners representing 3 branches of government. So we have representation from the governor's office, the General Assembly, and from the Ohio Supreme Court Justice. And then we have seats at the table from that are reserved for directors from different state agencies like Rehabilitation and Correction, Department of Health, Mental Health and Addiction, which is now the Department of Behavioral Health. So all of the different state departments also have seats per statute. We are required to do an annual report. I am going to recommend, when we talked a little bit about return on investment, Jessica, we're still showing child support payments going up when dads exit our programs that we're funding. We're trying to work with my colleagues here at the Department of Children and Youth, which is where the Commission on Fatherhood sits, to try and measure foster care savings. And having this structure has helped out so much because it's not as difficult as it was in 2012, 2013, 2014 to recommend fathers have a seat at the table in all of these different systems. So there's all of these different work groups in Ohio that I participate in, or one of my staff participates in, or one of our fatherhood practitioners that we're funding. So that's the other piece that we're doing as well, is funding programs. So we fund programs, we make policy recommendations, we train practitioners statutorily required to have a fatherhood summit in the state once every 4 years. And then we also do a lot of presentations. We present to CASAs. We present to folks at the Department of Developmental Disabilities. We did a training for folks at Mental Health and Addiction and at ODH for maternal health. I am going to be moderating a Black maternal sort of panel at the State House in April that will also include fathers. So I will moderate that panel of fathers. So I will tell you that over the years, and I don't have a mic drop yet because I I want to make sure that we have fatherhood programming in all 88 counties in Ohio. We now have, let me think, 32, no, yeah, I think we now have about 34. I'm sorry, we have 34 counties, and we now have a procurement opportunity out to pick up the other 54 counties, so that by July, we can say fatherhood programming is in all 88 counties. So having this type of state structure, again, which does not cost a lot. We're talking $5 million in TANF funds is what I have for 2 years. We're funding 22 counties under that. And then we're also funding under the Responsible Fatherhood Initiative funding. It does not cost a lot of money, $25 million over 2 years, right? And we can serve fathers in parenting, co-parenting, helping dads get employment, helping dads to obtain parenting time orders so that they can see their children. The structure is not difficult at all. It just takes champions at your state level to do that so that the work can trickle down, so that the funding can trickle down and the policies can make sense and be father friendly and father inclusive. We're at the table when we're talking with our children's services folks. We continue, like many states, Jessica, to fail the CFSR. Right now, we have the Children's Bureau here in Ohio pulling cases, and it doesn't look good. We're probably not going to do good regarding father engagement, but we have a toolkit that we did put together for Child Protective Services workers to access on how to engage fathers in this work. We're funding a fatherhood program in Cleveland called EPIC, Engaging Practices to Inspire Change. And what this program does is we have a fatherhood practitioner that sits inside of the Children's Services Agency in Cuyahoga County. He's not a county worker. He is a fatherhood practitioner, and he is there to ensure that dads show up for their case plan meetings and to make sure that they understand their case plan, so forth and so on. So this, and I know we're the only state that sort of has a commission that functions and operates this way, but it really allows us to be in those places and spaces where it had been traditionally difficult for us to get into, but now we're asked. I get emails, "Hey Kim, can you come and moderate this? Do you have a fatherhood practitioner who can do this? Can you give us the name of this program in this part of the state?" And so now, rather than us going out and trying to find our way at the table, we are now being invited to the table.
Wonderful. Thank you for sharing that. So Richard, next question for you. You're a very powerful spokesperson for the crisis of men and boys. And fatherhood and family is one of the 5 focus areas of the American Institute for Boys and Men. To what extent do policies and programs needed to help fathers overlap and differ from those needed for men and boys?
Yeah, that's a great question, Chris. I mean, I think there's a huge overlap. I mean, as the thing I put, the paper I put in the chat shows, it's just that, there's a huge extent to which just helping dads means kind of helping men, especially men from more disadvantaged backgrounds, to do better. And I think to some extent, a lot of these challenges we're seeing around kind of family stability, fatherhood engagement, etc., are downstream of many of the other policy areas. So we think that, and the report mentions this, but education, incarceration, housing, etc. Men just don't pop out of a cake as a ready-made dad, right? The kind of father that they're able to be and to bring, right, is the result of years, if not decades, of the investments or lack of investments we've made in them as boys and as men. And I'm very struck by the evidence that male disadvantage is one of the things, Chris, that led me to do the work around the book on AIBM, is that male disadvantage is even more intergenerationally transmitted than female disadvantage, right? Both are transmitted across generations, but boys struggle even more than girls if they have a difficult upbringing, right? And so what that means is that if you have poverty and you have inequality, it's just going to affect, on average, the boys even more than the girls, which means that they then struggle themselves to become the kinds of dads and partners that they would want to be. And so the cycle turns, right? So I think the irony here is that if you're serious about inequality and poverty, then you have to be serious about men and boys and dads, right? If you're on that side of the aisle, if you like, on that side of it. But on the other hand, if you're serious about families and you're serious about marriage and you're serious about parenting, then you have to be serious about poverty and inequality. And I actually see the debate playing out in a way that you almost people choose one or the other. The huge mistake that I've made in my work that I'm now trying to address through AIBM and through my own forthcoming work is that I have previously talked about the importance of fathers for children. And the report does a good job of summarizing that evidence. That's all true, right? Engaged fathers make for healthier, happier more flourishing kids. I think most people on this call probably know that. The thing I really have missed uh, is how important fatherhood is for fathers. And increasingly, our work takes an approach which looks at the kind of healthy development and flourishing of men, which includes as dads, and how important fatherhood is for fathers. I've had fathers come to me in tears sometimes saying, all I've heard you talk about is how important dads are for kids. But I had one father just last night in tears saying, being a dad is all I have left. I didn't see any charts on that, right? And so this kind of bi-directional thing about the beauty and importance and transformational significance of what it means to be a dad, and I speak as a dad, is something that I think we miss too often in these policy debates. And so taking that developmental approach, and that fatherhood really matters. And I think more and more men are realizing that. And so we're moving in that more developmental approach to look at how it matters both ways. And I think in doing that, we'll help to break this intergenerational cycle that Kimberly and Jerry have both already referred to, because this is a long game, right? Anyone who's been in it knows it's a long game, but the payoffs will be significant if we get it right.
And one of the things that we're seeing with Gen Z and millennial fathers is that they're placing much more of their personal identity as men, as people, on their fatherhood success. And so that's both encouraging and also a bit frightening, because these young men are starting to reach out more and more for assistance. And our communities need to be ready to provide that kind of assistance, because the demand now for father supportive programs and policies is greater than ever.
I completely agree, and they're doing it, Chris, in a way that is beyond the sort of economic breadwinner. They know they're not going to be the same kinds of fathers as their fathers were, and in many cases, they're motivated to do better than their dads. But also, they largely welcome the fact that women are now 40% of the breadwinners in U.S. households, right? 40% of women earn more than the typical man now, which was 13%, and most young men welcome that. But they also doesn't. They don't. We don't want to ditch dads in our correct push to gender equality. And I think that's the central tension that we're all
Yeah.
struggling with.
So, Sherry, next question is for you. You're a leader in a state agency that's committed to engaging fathers in improving maternal and child health using a whole family approach. Every state has maternal and child health programs. What has been your experience with engaging fathers in these programs in Georgia?
Well, in Georgia, I'll give you a brief history because it'll help you understand where we are now. In Georgia, we began working on fatherhood about 7 or 8 years ago. And our initial strategy, because all our work on family engagement is extremely strategic, it's intentional, with full-fledged plans and quality improvement tools that we use to get this work done. But we began by gathering a group of agencies. It first began with a group of agencies, then we added some community members together with us and created a committee to just start looking at what was available for fathers in Georgia. So that was our initial start. It grew and grew throughout the years. And then it got to a point where that committee was moved out into the community. And so our great partner, Morehouse School of Medicine, was the one that helped move the committee out into the community. So with that community consortia, and it has all kind of state agencies. We have different members from the community, whether it's faith-based, barbershops, nonprofits, the whole gamut in the community, and they provide the support. That committee or consortia became a 501c3, and so they have a full-fledged support for anybody that wants to work on anything fatherhood in Georgia. So they work on things like legitimation, reentry, health, mental health, like the list goes on and on. So that committee been moved out to the community and being sustainable allowed us to now start working specifically on fatherhood as it relates to public health and maternal and child health. So we've been working directly in the maternal and child health realm for about 2 years. And when I say the programs under maternal and child health, our Division of Women and Children's Services, are on fire about working with fatherhood. And Eric Raseri with you guys, the National Fatherhood Initiative, and we got together and developed a training series for each of our programs to go through. So they go through a training of about there are 3 to 5 training topics that they can go through. Each program will go through it. So far, we've trained our children and youth with special health care needs, children medical services program, and our early intervention program. And we just recently wrapped up training our MEGV home visiting program. So they step through a series of 3 to 5 trainings. The program staff themselves, the staff at the district level, any provider or partners that were part of the agencies, any local agencies that were like our home visiting agencies and such. Everybody was included in the training. And then after the trainings, they all went through an assessment to assess their readiness to support fathers and engage fathers in the work. And then we went through sessions that helped them develop specific work plans. So what really helped our programs get so excited about doing the work was that they didn't have to think about it. We provided them with the training, with the support, with the how to. They didn't have to think about the what or the how to get started. The other thing that we provide for them are a lot of the tools that you guys have, some of the printed resources and some of the training specific for fathers. So it's just been amazing, the I guess the welcoming of the work, and they're just on fire within their communities with what they do for fathers. And we started on the child health side of maternal and child health, and moving forward, we're moving into the maternal women's side. So with that, we're bringing in what we're testing what we're calling daddy packs, and they're just envelopes full of information, some of the printed materials on tips and tools about being a father, new dads for new dads. And let's see, we're doing the tips and tools. There's a resource on child development, and we're going to be sending those packages out to some of our local programs. We're also going to be using that program to work with what we have in Georgia. And I think 5 states, they may be up to 7 states now, but there are only a couple of states that have a project called Prams for Dad, the pregnancy risk assessment monitoring system that goes along with the regular PRAM systems, which monitors the experiences and behaviors of mothers. So now we're able to speak with or work with the dads that are connected to those mothers to see what their experiences and behaviors are around birth, prenatally, before, during, and after birth. So that's one of our projects. And the last of our projects that's really exciting is working directly in the community. We're doing a pilot where we have community mini grants. We right now provide 10, and the number of applications we had the first year was right at 50, the second year right at 70. And that's was just with the opportunity for 10. So that keeps growing strong. So when I say Georgia is on fire, not just us, it's the partnerships that we have in the consortia. Um, there's there's just so much, and the spirit of it is so wonderful and great.
Sherry, can I ask you, can you do this fatherhood funding within your existing budget? Can it come out of block granting, or Do you need a new appropriation from the legislature? How do you stretch to
How do we
fathers'
put?
money?
So
Yeah,
we do currently use our Title V block grant funds for
okay.
our Fatherhood initiative, and we previously were a recipient of the Healthy Start grant. So we that was one of our first iterations of funding for our fatherhood program. But currently, we use our Title V block grant funds.
So other states could presumably do this as well, yes?
They very well could. Yes.
Thank you.
Great. So I want to ask
Chris, I'm
all.
sorry. Can I real quickly?
Yeah.
Okay. I just wanted to thank Ms. Sherry for that, because starting in maternal health is amazing. I think it's a really good idea because that's what I look at as early intervention. So we also funded a fatherhood program, Dads to Be, who walked alongside Moms to Be. The Ohio State University worked with pregnant moms and moms of infants up to the age of 1. But then I funded a program to also work with those fathers of those same infants and those same expecting fathers. And so I think there is something to be said about that connection that dad has at the very beginning when mom is expecting. We in Ohio, we do have an infant mortality issue where Black babies die at almost 3 times the rate as Caucasian babies. And so, as DCY, the Department of Children and Youth, one of our goals is to decrease that infant mortality. So, Chris and my NFI friends, if infant mortality drops by 2 times when dad is present, why are we not putting funding into bringing these dads alongside mom to keep babies safe to their first birthday, right? And so I just wanted to just say thank you so much, Ms. Sherry. We're doing the prams as well for fathers. And so any state that wants to hear more about that, please reach out.
Yeah, we call that the golden moment for father involvement is the perinatal period because of the research that's really clear that when you connect fathers with their kids during that period, they're more likely to be involved in their children's lives as their children age. So I want to just take a moment to ask all of you one final question. If you could be brief in your remarks so that we can address any questions that may have been asked during the webinar today. And I'm going to kind of modify several of the questions into one that we sent to you. So I hope this doesn't throw you a curveball, but I'm sure you can handle it well. So we'll start with Richard. This has to do with the prevention theme that's come up in your remarks. So, Richard, if you had a choice to fund one or two preventive strategies in this arena, what would you fund that would make the biggest difference?
Can you just define what you mean by preventive for me, Chris?
Yes, preventing as many children as possible from growing up without involved fathers in their lives.
Uh, yeah, I'll keep it general and quick. The first thing is that for all the efforts that have been made, I still think our child support system, especially for unmarried fathers, remains way insufficiently supportive of parental relationships of the relationship between fathers. I think we are slowly but surely getting better at this. But honestly, I think if we were to start from where we are now, we would have a very, very different model for the way that family law treats unmarried parents, and the way that, in particular, the separation of the idea of the father as a economic agent and the father as a parental agent, which you do not see for divorcing couples. I think I'll go as far as to say I think it is a travesty in our current family law system, and just means that we are inadvertently benching our fathers. So that sounds like a negative, but I think we're doing so much harm through the misapplication of family law. And second thing is, I think this whole area of healthcare and just involving dads in these early education, early care, like we're seeing rising depression rates among dads, and studies showing that, like, even when you do have home visitors or early educators, that they will actually not involve the dad in quite the same way. And so I think that just some of the stuff we're hearing here about just involving dads in them. I'm in Virginia right now, and one of the things that I'm learning about is a Dads at Doors program. It's very simple, it's very small, it's a civic thing, it just gets dads in schools. And I just think that one of the one of the most powerful lessons from the women's movement is you can't be it if you can't see it. And if we can apply that to dads in our schools and our early education environments and our healthcare systems, and that they must be father inclusive by design rather than by afterthought. Those are the places.
Okay, great. Thank you. Sherry, same question to you. What one or two things would you fund from a prevention perspective that you're not already doing now, by the way?
Overall, something I think that crosses like all systems that would be helpful is the supporting healthy relationships. So the relationship and whether or not, based on your statistics, they're married or unmarried, which we have a high population of unmarried fathers and mothers at this point. But the healthy relationships, regardless if the father is in the home or not, would help create a more stable place for the child. Because at the end of the day, we want everybody to be healthy mentally and physically. But if the relationship could remain healthy between the father and the mother, that's going to be healthy for the child. And if the relationship is good between the father and the mother, if we're talking about healthcare and pregnancy, then that still is better for the family being stable and the health outcomes for the father. So my number one is the healthy relationships.
Great, thank you. And same question to you, Kim.
Okay, I did want to mention real quickly too, as far as child support. So I agree with Mr. Richard Reeves. States need to ensure that they're looking at self-sufficiency reserves, right-sizing child support orders is huge, right? We know that when the child support is an amount that the non-custodial parent can pay, they're more likely to pay that. When it's an amount that is just, out of the ballpark, they're probably not going to pay it. And then they build up arrears and then all of a sudden they disappear. So I think that as well, right sizing and the self-sufficiency reserves to ensure that the non-custodial parent can take care of himself or herself, because we do have moms paying child support, before we talk about the amount to be paid for the child. We fund a lot of different things, but I have to agree with Ms. Sherry. Healthy relationships is absolutely a must. And again, just going back to my years in child support, the cases that were so difficult to collect, there was no relationship to begin with. So again, that prevention piece of ensuring that the youth, that these young adults have strong foundations, individually. There is this education component, this economic stability, spiritual stability, emotional stability. We're working with fathers because, again, mental health has come up over the years since COVID, right? And so are you in a place and space, again, to have a child? So some of that prevention, but then once that does happen, and if there is a child on the way, it is about this healthy relationship, so that you can amicably co-parent when that child is born. And so we are funding a lot of programs. Again, anyone that's interested, you can take a look at the website, fatherhood.ohio.gov. All of the programs are out there. All of the pilot programs are out there as well. But again, I think if we don't get upstream and start putting money more towards these types of efforts, I know you said it would be difficult for us to do another sort of research on the cost of father absence to taxpayers, but we will be taking a look at a $200 billion man if we don't if we don't do something upstream, right, to address some of these issues.
Great, thank you very much, panelists, for your wonderful input. So what we're going to do now is we're going to move into the Q&A portion of our webinar as we close out things today. Melissa, do we have any questions for the panelists?
We have some general questions. Some may be more obvious than others toward a specific person, but I'll go ahead and ask. We have about 5. Kurt Reisdorf asked, what is the thought process for those fatherhood programs moving toward the end of a state or federal grant cycle, and how to establish sustainability when working inside of an existing nonprofit. I've noticed many programs where funding is tied to state or federal grants are not being renewed. The issue is that fatherhood programs are handcuffed to get to sustainability because of nonprofit dependence on state and federal grants. The intention for these programs in my state is for them to be volunteer driven and not state or federally funded long term.
So Kim, I think that's a great question for
Yeah,
you because
that's your ballpark.
Yes, and so
you've
excellent question. And that's my responsibility as executive director to get the funding so that we can continue, right, from this year. So we have what, 25 million for this biennium. You know, I need to show return on investment, show what my programs are doing that are being funded so that, and show the $154 billion man, so that we can continue to go to our General Assembly and to our governor to say we need more, we need more. So we've been funding programs since I'm going to say 2006, and with nothing in between, no breaks in between at all. But I think the other piece too is ensuring that some of these other like state programs, like maternal and child health, like child protective services or other programs that have measures, child support, that they also, not just through grant funding, but also offer funding through some of their programs as well. I tell my fatherhood practitioners all the time, because we are county administered, state supervised. So we have 88 counties doing things kind of sometimes 88 different ways, but for the most part, the state kind of oversees all of that. When you talk with child support, or when you talk with children's services, or you talk with any of the systems, your schools, talk about the kindergarten readiness. That's something that is an issue here as well in Ohio. Our babies are not ready for kindergarten. So programs, why don't you go and talk to your Head Starts, your preschools, about what can they do, or how can they help you to maybe pay for some of these other activities that would include fathers into programming, bringing them into the schools. Because again, we know with father facts that when dad is involved, right, our kids do better academically. The other piece that we're trying to do is keep kiddos out of foster care. So how do we do that? Well, we need to work with the Child Protective Services agencies to ensure that dads are being engaged. So what is at the local level, or what is at the agency where they can maybe help with some pilot funding or some type of funding or program funding that way as well. So yes, it is my job to keep the money flowing, because that is one of our purposes, is to fund programs. But I do understand when you're 2 years like ours, or even 5 years like the HHS grants, that sometimes it is difficult to sustain. And so that's why I say reach into the systems, the government systems that have measures that they have to meet, and how they can kind of put a little bit of skin in the game as well.
And I want to get to some of the other questions, but let me just respond to that question as well. I think one of the areas where many fatherhood programs lack capacity is in private fundraising. So fundraising for private sources, individual donors and foundations. There's a lot of money available from those sources, but many fatherhood programs are reliant, as Kurt pointed out, on public sources of funding. So that's one of the areas where we work to build capacity as well. So, Melissa, what about the next question?
Sure. Ryan Berryman asked, are you able to provide more information on TANF 3 and how nonprofits could seek funding?
The TANF black box, TANF funding. Every state does it differently, and it's a secret about who makes those decisions, right?
So panelists, do any of you have a response for that question?
Right, for me, TANF Purpose 3 and 4, that's what we fund. You put more into TANF Purpose 3 and 4, you could potentially put less in 1 and 2, right? 1 and 2 are the needs-based, that where moms go in for cash assistance, maybe childcare, SNAP, whatever that may be. Because she's a single parent mom, she qualifies for these benefits. If we put money into TANF Purpose 3, prevention of out of wedlock pregnancies, which speaks to this report, And then TANF Purpose 4, which is supporting and advocating two-parent families, including marriage. If we put money there and we're supporting mom and dad in rearing of their child, then mom could potentially not need TANF Purpose 1 and 2. Just my philosophy.
Nationally, there is only 0.05% of surplus or uncommitted TANF funds that go for fatherhood for 3 and 4. And only, about 20 states put allegedly some money into it, and there are only about 10 that put anything. That's it's very, very limited, and it's been very difficult to access.
Yeah, I read a report not too long ago, and I don't remember the exact figure, but there are multiple billions in the B of TANF funds and in surplus accounts across the states. It's
In
just,
some states, that's true. In some
yeah,
states, that's true, but a lot of states have no surplus. So
yeah,
it just varies, and you can't, it's not, and it's not, you don't put in an application and raise your hands, apply for them. It's kind of mysterious, and some it's decided at the governor's level or in a legislative back room or at the TANF agency, all different in every state.
yeah. So Ryan, I think the message here is to do research. I know you're in California on how TANF works in your state, and who's responsible for making decisions around that, and see what you can learn.
Right.
Melissa, next question.
Yes, Mark Sutton says, I believe 4 states, including Ohio, have funded fatherhood commissions. And just recently, Virginia created a commission for men and boys. Thoughts on whether states should aim to create fatherhood commissions or more broadly focused men and boys commissions that could include fatherhood support, among other things?
Yeah, there are 4 that nominally have commissions, but they're well, Pennsylvania has a legislative one. It's not funded. Others have councils that are not legislative that do a lot of the things that commissions do, like try to do that. Kentucky, Michigan, Washington. Some have task forces. They're all different kinds of initiatives that are out there. Kimberly is, she's got the gold star for both the buy-in and community support and funding, right?
And policy.
And
Big policy
policy.
person, yes.
Policy and the engagement of state agencies and legislators. And I think that would be great. I think that's what we really need to grow this at all. It's a multi-agency, multi-initiative problem. We need multi-agency, multiple initiative strategies. And so we've got to have a big tent.
Bantu Gross mentioned that Louisiana is on their way to creating a commission.
Yes, yes.
Okay, let's see, another question to Mr. Reeves. What is your experience in the difference between the US and Europe when it comes to today's discussion on fatherhood?
Ooh.
Yeah, they're so different is the problem. It's just the policy environments are so very different that it's sometimes hard to compare. But I will say that I think the evidence that we have from European countries, particularly around kind of paid leave and kind of involving fathers, if it's decent wage replacement, it's independently available to fathers, it's pretty strong. We're now seeing a number of states, of course, who are introducing paid leave, but I actually see, I'm working in the UK and a bit in the Nordics as well too. What I find interesting is kind of in relation to the previous question too, about separate commissions versus joint commissions, a growing awareness that you can't just put fatherhood into a separate policy or scholarly bucket. Like it is, as I think as we started off, right, like you've got to look at how boys and men are doing, like economically, how they're educationally, in terms of their mental health. And so I think that would sort of speak to a more holistic approach and seeing fatherhood not as this separate area of policy, but actually as a load-bearing wall for everything else we want to achieve. It's a labor market policy, it's an education policy, it's a workforce development policy, it's a health policy. And I'm seeing good signs, particularly in some of the Nordics and the UK, that is the way that they're approaching
They,
fatherhood.
they also treat child support differently. It's not just a
Totally
private
differently.
responsibility. They're
Yeah.
universal,
It's completely
payments.
universal system, so it's very different.
Yes,
And
they're
we don't have the
universal.
same, and Europe does not have the same system, does not have the same
No,
history around fatherhood and child support that the US has, especially since
that's
the
right.
90s. It's been a very different kind of, I will tell you, having moved from a UK policy environment to US, one of the biggest differences is not just the substance, but the tone of the discussion about fatherhood. I mean, the very fact that they're called responsible fatherhood grants tells you a lot about where this comes from.
Was that the last question, Melissa?
There's more, but
How much time do we have?
we are at time right now.
That's what I thought. Okay, great. All right, so we will attempt to answer those questions that we didn't get to and send emails to those individuals who asked those questions. But I do once again want to thank the panelists, Richard, Kim, and Sherry, and of course my colleague Jessica. And I want to sort of close this out by acknowledging the work of CPR in this report. CPR really carried the heavy load in developing this report. I mean, we started this work I think it was 2.5 years ago.
Who's counting? But yes, 2.5 years ago. Yeah.
It was a lot more effort than we could have imagined, but it was definitely worth it. And I just wanted to publicly acknowledge you, Jessica, and also Rachel Wildfuhr, who worked a lot on this report, and you'll see her information here on this final slide. So, if you have any questions about the report, after you look through it, after you look through the how to use document, please don't hesitate to reach out to me or Rachel at the email addresses that you see on this slide. And on behalf of all of us at NFI and CPR, we want to thank you for attending and hope that you will find this report useful in your work. So take care, everybody, and have a great rest of your day.
Take care. Thank you. Thanks, everybody, for coming.